Hello and welcome to my presentation of key findings and recommendations related to the medical staffing plan for this upcoming influenza season. This presentation will walk you through a brief overview of the project, key analyses of the data, and finally concluding recommendations and next steps. Starting with the project overview. The motivations behind this project were threefold. As seen in the chart on the top right of the page, over 70,000 people die each year in the US alone from influenza. Moreover, members of vulnerable populations are at particular risk of dying from the flu. When influenza season is at its peak, hospitals and medical clinics must ensure they have an adequate number of medical staff to treat patients. Objectives. My primary objective has been to develop a staffing plan to ensure hospitals and medical clinics have an adequate number of medical workers to respond to influenza cases. Scope. I analyzed data sourced from the US Census and Centers for Disease Control. This data covers all 50 US states from 2009 to 2017. Hypothesis. States with higher proportions of people classified as vulnerable will require additional healthcare workers during peak influenza season. Who is considered part of a vulnerable population? This analysis focused on people over the age of 65, a key demographic in the US that is considered vulnerable to the influenza virus. The chart on the bottom left lays out a scatter plot of the number of deaths of people over the age of 65 and the population of people over the age of 65 in a given county. The black line moving up and to the right is the trend line. You see that the individual data entries, designated by the blue circles, align closely around this trend line. This suggests that there is a strong positive correlation between these two factors. In other words, in counties where there is a high number of people over the age of 65, we would expect to see a large number of influenza deaths. The chart on the bottom right is a histogram showing the frequency of deaths in a given county in each month. The chart is broken into segments by age group, with people over the age of 65 designated blue and people under the age of 65 designated gray. As can clearly be seen, people over the age of 65 make up the majority of deaths, further supporting the hypothesis that this population is at the highest risk of influenza-related death. This is a good point to pause and mention a key data limitation of this analysis, and that is that this data set, which again was sourced from the Centers of Disease Control, do not publish county-level death counts for a given month when less than 10 people died from the flu. As a result, this chart here and the entire subsequent analysis I'm presenting here today shows only those death counts in counties that were greater than 10. Now that we've established the key vulnerable population demographic being analyzed, let's now address the next question. Where are the highest number of influenza deaths in the United States? The map on this page shows two things. First, it shows the number of influenza deaths per state. This is displayed as a choropleth map, where the dark green states have the lowest number of influenza deaths, and where red states have the highest number of influenza deaths, those states that are colored yellow or somewhere in the middle. As we can see, California, Texas, Illinois, Pennsylvania, New York, and Florida are the states with the highest number of influenza deaths. This map also shows the proportion of a state's population that is over the age of 65. It is designated by the black circles atop each state. The states with the largest bubbles, such as Florida and throughout the Northeast, have the highest proportion of their population over the age of 65, while the states with the smallest bubbles, as you can see, Utah, California, and Texas, have the lowest proportion of their population over the age of 65. As we've discussed, the population over the age of 65 is most vulnerable to influenza-related deaths. And so it is important to consider how many of these people are living in a state when determining the medical staffing plan. Next, we'll move on to understand when during the year is peak influenza season. There are two charts on this page. The bottom left chart shows the number of influenza deaths by region of the US from 2009 to 2017. Midwest is blue, Northeast is orange, South is red, and West is green. This data, while only years are shown at the bottom of the chart, this data is monthly. And we see that for each region, the number of influenza deaths is highly seasonal, going through regular peaks and troughs each year. The bottom right chart aggregates this data for all years and for all regions and shows this monthly variation in influenza deaths across a single year. We can clearly see that influenza deaths start to rise in October, reaching a high level in December before peaking in January and staying elevated through April. We can conclude from this chart that December through April are the peak of influenza season. We'll now move on to the conclusion. In summary, I've presented my findings that individuals over the age of 65 are the most vulnerable to influenza-related mortality. I've shown that certain states have the highest number of influenza deaths. These states are those with high populations, and specifically high populations of people over the age of 65. Many states, including Florida and New York, also have high proportions of their population over the age of 65. This density is a major consideration for the staffing plan as it creates a higher risk of transmission across the elderly population. Finally, I've shown that December through April are the peak months of influenza season in the US. My recommendation is to deploy additional medical staff in California, New York, Texas, Illinois, Pennsylvania, and Florida, along with those states with a high proportion of the population over the age of 65, between the months of December and April. As for next steps, it will be important to conduct additional analyses on other vulnerable populations. As I've mentioned, this analysis and the focus of the data sets analyzed were on the population over the age of 65. However, there are additional members of the vulnerable population, including children under the age of 5, people with pre-existing conditions and who are immunocompromised, and pregnant women. It will also be important for the staffing agency to conduct surveys with their healthcare workers so as to understand these workers' fears and hesitations around working during peak influenza season. Doing so will allow the staffing agency to proactively offer supports that will allay these concerns and help ensure adequate staffing. Finally, my hope is that you will compare the findings presented here today with staffing plans from years past to make any necessary adjustments ahead of future influenza seasons.